Digestion problems, you know, those bloaty, queasy, uneasy feelings. Not only are they uncomfortable, but too often just the idea of suffering from that really discourages us from enjoying our favorite foods. And I know this because my husband suffers from this. Well, ladies and men, have no fear, the doctor is here. With us today, Dr. Doug Haghighi, who's not only a Cleveland Clinic trained gastroenterologist, or GI, but as a Harvard trained dentist, he's also the creator of a chewable product that we can really sink our teeth into this morning. Good morning.
Hi, nice to see you.
Thanks so much for being here. So let's talk about, let me tell you, my husband, I have stories to tell you. Let's talk about the digestive stress that we're all going through. What's going on? I mean, to me, it's more prevalent than ever.
I think it's reasonable to say we live in a caffeinated society and a fast-paced one. People are eating on the go, eating fast, and making food decisions out of convenience, which are higher in fat and sugar. This lends itself to abdominal stress, reflux, and heartburn, and plays a role in what I consider the biggest public health issue in our country today, and that's one of being overweight. Having extra pounds on board, especially in the belly area, can really exacerbate reflux.
And let's talk about burning and bloating. What exactly is happening down there? Because I'll hear my husband saying, oh my gosh, I'm bloated. Oh my gosh, I feel some burning. What's going on?
So gastroesophageal reflux disease is defined as passage of contents from the stomach to the esophagus. The burning sensation is one of heartburn. Triggers include coffee, caffeine, fatty foods, as well as alcohol. Lifestyle triggers are smoking and weight loss, as we've discussed. Bloating is defined as fullness in the abdomen, especially right beneath the ribs, that causes discomfort.
And it does cause a lot of pain sometimes.
And there's a few mechanisms. One in particular is swallowing air, so-called aerophagia.
Oh.
And this can be a consequence of eating or drinking too fast, which I'm guilty of, talking on a cell phone and eating at the same time, as well as chewing gum for a long period of time and sucking on a straw. Another mechanism has to do with the bacteria that normally reside in our gut. There's a population, and sometimes this can get skewed, and these bacteria can overgrow. This can happen in certain disease states, such as scleroderma, where the contractility of the bowel is not optimal, and bacteria tends to increase in population. Other risk factors include recent antibiotic use, recent gastrointestinal infection, and surgery on the digestive tract. Also, diverticular disease, or the small little pockets that form in the bowel with age, are a nice reservoir for bacteria.
And I know a lot of people, especially my husband, he's tried so many reflux medications, heartburn medications. I mean, the list goes on and on, doctor. I can't even begin to tell you. So, and there's some side effects. So what advice would you give to patients?
Proton pump inhibitors are the most commonly prescribed medications for acid disorders. They've been around for 25 years. They work relatively well and are usually well tolerated. But they do have some side effects. The common ones, abdominal pain, diarrhea, headache. Of concern, though, over the last few years, they've been associated with a decrease in calcium, decrease in magnesium, as well as a vitamin B12 deficiency that can lead to very serious medical problems. They've also been associated with a pneumonia as well as a Clostridium difficile type diarrhea. Now, I commonly treat gastroesophageal reflux disease. One size doesn't fit all. And
you've developed something that you believe really works, and I really want to try it for my husband. Tell me what it is.
So this is Gussie Julie, and you can see our friend Gutsy here with his hands on his gut, and he's gut good right now. Now in life, you don't have to be sick to get better, and I kept hearing from my patients that certain natural products worked. So I did a fair amount of research. We came up with our proprietary formula of apple cider vinegar, licorice root, and papaya. Oh. We put science behind it and did a double-blind placebo-controlled trial, had positive results for a decrease in heartburn and a trend towards decreasing nausea and abdominal pain.
And I got to show my viewers how cute Gutsy is. You actually created the character. Can I show them real quick? Sure. Let's take a look.
Hi, Gutsy. What's going on?
Dr. Doug, I went out for dinner and had pizza, burgers, fries, coffee, and chocolate cake, and now I have a queasy, uneasy, refluxy feeling. Bottom line is, my gut is burning.
Now, he's adorable. But the question is, how does it work?
The proprietary formula, there's not a lot known about the natural remedies that are in there. It does contain xylitol to enhance oral health and decrease tooth decay, as well as calcium and magnesium. It is gluten-free, lactose-free, and vegan-friendly. It enhances the body's own defense mechanism against reflux while knocking down that after-eating queasy, uneasy, refluxy feeling.
Are there any misconceptions when it comes to the natural products with the digestive tract?
Well, I don't know so much misconceptions, but I think some skepticism. In the whole pie of healthcare, there is definitely a role for natural products. As time goes on, this is going to grow. There needs to be science behind natural remedies, like we did with our proprietary formula. Ultimately, natural remedies should be under the same scrutiny as medical products in terms of safety and effectiveness.
So let's use my husband, for example. Poor thing. He's probably saying, why are you throwing me under the bus today? What would I tell him to do if I told him to try the wild berry?
So Gutsy Chews is unique. You can take it on a daily basis because it augments calcium and magnesium and the stores of these important minerals in the body. It also has xylitol to help maintain and optimize oral health. But the main aspect is when you get that after-eating feeling of gut burn and gut bloat. Gutsy Chewy will provide rapid relief and get you gut good.
Really? I got to tell you, I'm going to give it a whirl with my husband, and if it works, you are a godsend, okay? Gutsy Chews, several flavors, right?
Yes, wild berry and citrus.
Where can viewers find out more information about Gutsy Chew and actually medical information about GI problems?
The best place to go is gutsyproducts.com. There's news and notes on digestive health, but that's the place to go if you want to get gut good.
What do we got to lose?
Reflux.
I like that. Thank you so much, doctor. Really appreciate your time. That was very cute. You've got guts. That was cute too. Be sure to visit us at thebalancing.com or log on and share with us at Facebook.com/The Balancing Act fans your thoughts and comments about today's topic. Gutsy Chewy. Love it.